Hi, everybody. Welcome to Dr. B Addiction Recovery. As you know, on this channel, we deal with substance abuse and related issues. Our primary goal is to take the scientific data, intermingle it with clinical experience, distill the two, and bring down information for you that you can chew on, digest, and make sense of, whether you're the addict, a loved one or family member, or the public at large. And in this way, we hope to demystify a very dark and mysterious area that may be affecting your life. Today's question asks, what is methamphetamine psychosis? Uh, and we will answer that question in really simple, easy to digest terms, always having the scientific data in the background and what it means from a clinical perspective. I think this is important for several reasons, which will sort of flesh itself out throughout this discussion. Number one, psychosis is not a disease, it's a symptom complex or a series of different symptoms, and it does not matter whether the primary disease, what the disease that is causing it is. It might be methamphetamine induced psychosis or primary disease induced psychosis, which may be something like schizophrenia. And in that disease, this is a very prominent feature as a symptom complex. Nevertheless, in both cases, psychosis is psychosis. What exactly is psychosis? It's an issue of the way we process the external world around us. And this can take on many different forms, and it's explained in different ways. For example, you could have visual psychosis, hallucinations, and that means I see things that others don't see. You could have auditory hallucinations. I may hear things that others don't hear. I may have tactile hallucinations, things I touch. And with methamphetamine psychosis, it is common that you might see a certain kind versus another. For example, bugs crawling on you. These are some of the basic features of psychosis, whatever the cause of psychosis is, whether it's a primary disease that is prominent with the feature of psychosis, such as schizophrenia, or it's substance-induced psychosis, commonly seen with methamphetamines. Other features or constellation of symptoms associated with psychosis might be delusions. Okay, that means that you may have beliefs about the external physical world that is not in line with everyone else's beliefs. In addition, it is often and commonly social and cultural related, in the sense that it is not in line with the general beliefs within that culture. Okay. For example, you might have a very strong belief that in the evening, UFO, little green men come off of a UFO and they come to everyone's house, and that is what is normal. And they go around and they go into the kitchen and they might grab some snacks and eat it and leave. You might have a culture where everyone is raised with that belief system, and that would be normal. But if you have a culture where such belief system doesn't exist, that would be psychosis, and it would be a delusion. Other features often associated with this symptom complex that I'll call might be paranoia, right? I remember once in the ER a long time ago, there was a young man that was sitting there, and when I walked up to his bed, I had gotten the history, and this is many years ago, and he did have schizophrenia. I believe there was an affective feature to it, and he had locked himself in his apartment for days, if not weeks. And eventually they went in and found him in a closet, and he came out. And the first thing he started to tell me was that how he was working for the Secret Service, and he was affiliated and associated with the Ronald Reagan assassination, and at which point he quit his job, and the Secret Service did not like that, and they had been after him and spying on him, so he would not leave the house. Unfortunately, he was not even born during the Ronald Reagan presidency. Sadly, I was, and he was telling me about all of this. Another feature of these delusions and paranoia are often fixed around religious rituals that are very, very embedded within the cultural milieu and the paradigm and perception of beliefs that culture may have. A person may think that they are in touch, or they themselves are a figure like Christ or Muhammad or Buddha. Other features of psychosis may be violence, okay? Or maybe someone's talking to you in that delusional scheme and telling you to hurt yourself. In either case, all of these presentations are psychosis, whether they're methamphetamine induced or whether they're related to a primary diagnosis of psychosis. This presents a diagnostic challenge when you see someone presenting for psychosis, unless if you have a very good understanding of the history of events, meaning whether they're using methamphetamines, how often they're using it, and if you don't have that, you will often need ancillary testing to be able to tease out what is producing the psychosis. And this becomes very important for a diagnostic, in terms of diagnostic issues and labeling somebody with an issue. And treatment, although the treatments are really actually the same, but long-term treatment, family history, and so forth. Diagnosticians, clinicians often find this a little bit difficult. It really is not that difficult because you don't usually see a 50-year-old male presenting for the first time with a schizophrenic psychotic break, because schizophrenia usually presents in late teens and early adulthood. It is usually affiliated and runs in a family tree. So it's not as difficult, and this is where this brings us to the next topic. So number one, you do have to figure out why you're having the psychosis. The next issue with methamphetamine psychosis is this. It's very prevalent within the community or that subset of the populations that uses methamphetamines. 40 to 60% is what the numbers are telling us, I believe, worldwide. Some of the questions you might have is, when do you start to get them? How long do they last? And how much do I have to use before I get psychosis? This is an important question, and I don't have the answer to it, but I have some answers for you. And when I say I don't have the answer to it, we don't have a very set criteria or definitive cutoffs in the literature. We do know, like I said, 40 to 60% of users in the lifetime of their use will have psychotic episodes for a certain amount of time, okay? A subset of that population goes on to continue and have chronic psychosis, and it may just simply be hearing things all the time. That presentation of the symptom of psychosis has associations with how often you use and how long you use. But it's not strong enough where I can make definitive claims about when does psychosis come on, how long does it last. There is a clinical experience, but it's best not to touch on that. What's important to know is that let's take the acute phase of psychosis. It needs to be recognized and treated. And the treatment is the same as non-drug-induced psychotic presentations, which is benzodiazepines and some of the antipsychotics. And you can use this in acute situations or chronic situations. Does it make the voices get better and go away for the long run without any recurrence? Not really. What we do know, and this is interesting, if there's an active user, one of the first line treatments that can reduce the episodes of psychosis in the future is psychosocial, behavioral, mental health interventions. This is interesting because what it's saying to me is that if you keep the mind involved in a reality-based activity in a chronic way, you will reduce the episodes of psychosis in the future. In addition, we also know that prevention of methamphetamine relapse for someone that has just gotten off of methamphetamine use and abuse is a good predictor of future psychotic episodes or events. So if you're a user, and whether you have psychosis during your active use or not, and then you stop the use, you may have been hospitalized because of the psychosis, or you may have gone treatment because of your own choice. We do know that that event will curtail and minimize the chances of you having future psychotic episodes. So it's treated the same way as normal psychosis with primary disease events, and its predictability is very related to use and how often you use and the future of your use. In addition, the most interesting thing about the research and what has been shown clinically is intervention with psychosocial behavioral intervention prevents the chances of future recurrence. All of this is very important. And the reason it's important is that psychosis causes employment impairment, social impairment, and increases the chance of relapse. So the more we can do to minimize and prevent psychosis, the better chance we have at short-term and long-term recovery. In addition, I want to point something else out. Oftentimes, I have seen people that have maybe ceased their methamphetamine use, and it's been a few months to a years, or even sometimes when it's happening in the acute stage. And both of these situations I'll run into where someone continues to have persistent psychosis in the case of someone that has quit, or acutely someone's having psychosis. And it always baffles me, no one around is doing anything about it. And they may even be in treatment. And this is, for the most part, pretty easy to address, and it's often not done. So I want everyone to be aware of these symptoms and understand that it is psychosis, okay? And and if there's methamphetamine use and abuse that is obviously related and correlated with the patient's symptoms, action should be taken, and that's taking him to a clinician who understands these things. One other thing I would like to address: when to initiate and start long-term antipsychotic use. And again, that's pretty easy to tell because if the psychosis persists, whether it's auditory hallucinations or paranoia, you should initiate those. But you shouldn't put the label of schizophrenia disorder unless if you're certain that historically from the clinical evidence that you've gathered, this person suffers from schizophrenia. If you'd like to have more information on methamphetamine use and abuse, please click above to my left for other related videos. If you enjoyed this video, we'd really appreciate it if you click the subscribe button below to my left and the bell to get future contents. Thank you very much. Be safe out there during COVID, and see you next time.